So today we're talking about comorbidities and key factors that affect quality of life in MS. And it's really an emerging area of research and interest, but I think it's a very important area both for clinicians and for patients to focus in on this and not just focus in on treatment issues with multiple sclerosis specific to the disease. As Caitlin has gone over, these are my conflict of interest talks and participation in clinical trials over the past 5 years. So this is an example of the kind of problems that we deal with in terms of multiple different issues, comorbidities, smoking, drinking, obesity, trying to do exercise, just to set the stage for our talk. Let's go first to a case just to illustrate some of the complexities. This is a hypothetical case, not an individual patient. Janine's a 34-year-old right-handed white female. She worked as a nursing assistant till 1 year ago, and then she became unable to work due to illness. She had multiple sclerosis 4 years ago of a relapsing type with optic neuritis, spastic paraparesis or weakness in the legs in 2006, and a new episode of double vision and dizziness in 2007. And each episode improves, but leaves her with residual symptoms, and she's on one of the medications, interferon beta 1A. She's diabetic, but she rarely monitors her sugar. She's hypertensive, but not on treatment. She suffers from frequent headaches and chronic low back pain. She uses marijuana, which she states improves her symptoms. She fell down recently and broke her wrist, and she's apathetic, sleeps poorly, and has no initiative. This is a picture of our patient. So what this brings out is that multiple sclerosis is really more than disease-modifying agents. It is what we call a multidimensional disorder. There's a medical illness, but there also are issues in terms of work function, that is disability issues, social issues, interacting with other people, family issues, and work issues in general. So it's a complex, multidimensional problem. So what we're talking about here primarily is the dimension of comorbidity, and I have a McGraw-Hill definition of this. The simultaneous presence of two or more morbid conditions or diseases in the same patient, which may complicate a patient's hospital stay. In the U.S. healthcare system, comorbidity carries more weight, determining length of stay. But we can think of comorbidity as an outpatient problem in that people with multiple sclerosis don't just have multiple sclerosis. They also have other conditions that they carry along for the ride. So what's our approach going to be today? We're going to do a brief global review of comorbidities in general and MS. Then we're going to get into details on individual comorbidities, and then I'll lay out some ideas and things to think about, some simple steps to consider, and hopefully that will be a helpful review. So let's look at some studies, and what we will be doing is briefly touching on a number of studies that have been done in this area. Forbes did a survey in England, a postal survey reported in 2006 of 929 patients with MS, and measured a number of different measures of MS severity and impact. And basically found that 74% of the patients, really 3/4 of the patients, had 4 or more symptoms including fatigue, pain, urine incontinence, bowel difficulties, depression, pressure ulcers, sexual difficulty, or employment issues. So this is very common to have multiple different comorbid issues. And fatigue, pain, and employment and depression problems had a significant effect on a measure of quality of life, the SF-36. And that was independent of the impact of the disease. So these problems have their own life, if you will. They have their own importance in terms of what goes on that can be independent of the actual MS disability component.